We are so back. We're actually not. I don't know why I said that. But we are back. But we're not so back. As you can tell, the state of my room really reflects the state of my mind at the moment. We're back to studying. I want to dye a little bit. I want to fix my hair too, actually. The last video, I did not talk as much. I might talk a little bit more in this. It is Monday. My exam is on Monday. Next Monday. I take the freaking VTNE in 1 week. And honestly, at this point, studying for this exam, it is more of a marathon than anything. So if you're screwed a week before the exam, you're screwed completely. Like, no matter what you do, it's not gonna fix it. I wouldn't say I'm completely screwed though, but if I don't put in work now, I'm not gonna pass. I don't think. Maybe I could, but I'd rather be safe than sorry, you know? But you can be safe and sorry. That's a thing. Words, man. So, anyways, yeah. I don't want to do this. Screw this, but I have to. And that's what work ethic is all about. So, without further ado, let's just get into it. Also, who knows how long this mic is gonna last? It hasn't died yet, and I have not charged it since I got it, so. But it has a pretty long battery, I suspect. So we should be fine. So, kind of what I'm thinking, here's what I've been doing, is every day I review all these flashcards that I have made recently. All of these. It's a huge stack. It doesn't look that big, actually, but to do this every day, I mean, it takes like an hour. So I'm going to do that after I study something more specific, because this covers a lot of different categories. But I'm also going to add to the pile too, because I do have some empty flashcards that should probably be filled with things that I should probably review. Question is, what should I review? So pretty good on pharmacology and radiology. Parasitology I should probably freshen up on. Large animal diseases, laboratory, pretty good. Reproductive physiology, I definitely need to review that. Exotics too. Also, more specifically, the tick names, the vertebral formula for every species, the names of like the different genders of animal species. Like, what is the name of a female ferret? Oh, it's a Jill. I think it's a Jill. Is it a Jill? Yep, it's a Jill. So doing that, knowing the gestation lengths, yep, and knowing instruments, which I feel better about. Also, there's just small things in my head that I think throughout the day that I'm like, oh, I should probably remember that. So, I guess we'll start with parasitology. Also, random, but you know, I make these videos just so that I can hold myself accountable for when I study. And not really caring about the views or the numbers or analytics or anything, but I got a subscriber yesterday. And someone's liked my video. And someone commented, too. That was just weird, because I was not expecting to get any views. And one of my videos, I have 10 views. It's kind of wild. Anyways, parasitology. Equine parasites. I guess we could look at that. All right. Strongyles. Yeah, we got that. Equine lungworm. Maybe I don't want to do this. Anesthetic monitoring. Yeah. Okay. You know, let's just dive into doing some questions in the pile of done. I'm like overwhelmed with where to start, so. Also, Crow, my lovely kitty, is sleeping. Just thought I'd let you know. Which of the following scenarios describes the proper care of surgical instruments? Oh, this one's easy. You gotta pre-rinse them, put in the ultrasonic cleaner, put in milk, remove from milk and let dry. Done. Which of the following is true about the appearance of an image relative to the orientation of the slide when viewing through a compound microscope? It is upside down and reversed. Yep. Rats are known to produce a substance called red tears. They're produced in the Harderian gland. Oh, we got a drug calculation. I haven't done that in a minute. I need a refresher on that, for sure. Oh, this is easy. 35 kg dose at 0.01 mg per kg. 0.35 milliliters. No. Oh, and then this is 0.2 mg per mil. Divided by 0.2 equals 1.75. Done. Easy. Coprophagy is eating feces. What three parts of milk make up the uveal tract of the eye? I think it's the iris, choroid, and ciliary body. Yeah, the uvea. The normal temperature for a cat or dog. Done. 100, 102. When taking a lateral thoracic radiograph of a dog, where should the field be centered? These are the kind of questions that get to me because it's so anatomically specific, and I don't really care about that. No one cares about that in the real world. Seventh rib and the spine of the scapula? Probably fifth rib and caudal border of the scapula. Okay, that's right, somehow. A puppy presents for his caudectomy. Tail removal. Which toxicity is not a common concern in cattle? I don't know. Lead? Iron. Iron toxicity is specifically just for pigs. Tapeworm is a cestode. Lactate is not a measured analyte in a urine dipstick. You should not give a phenothiazine tranquilizer to an animal with which disease? No. Maybe? Yes, epilepsy. Phenothiazine tranquilizers such as acepromazine or chlorpromazine are traditionally thought to be contraindicated with patients with seizure disorders. Most recent research says that they're not as nearly as dangerous as originally perceived. Okay. Phenothiazine, epilepsy. 3-year-old castrated male Doberman Pinscher comes into the emergency clinic. I think I've only gotten one question wrong so far. Pretty good. Gastric GDV followed during initial emergency. Expected GDV, what imaging procedure would be most helpful in confirming the diagnosis? Do you want to put them in lateral? Right lateral. Yep. Dog has a high fever, is lethargic, and is diagnosed with peritonitis. What does the dog have? It has inflammation of the abdominal lining. Gram-negative bacteria is strep and staph are positive. Pseudomonas is sweet smelling. Clostridium or lactobacillus. I'm going to just say lactobacillus. Nope. Pseudomonas. Gram-stain is used in classifying 2 distinct types. Okay, Pseudomonas is gram-negative. Client who feeds his dog ad libitum is free choice. Not considered a clinically important large strong guile. Vulgaris is a big one. Equorum. Okay. In the beginning of the day, you are getting together the pre-anesthetic and anesthetic drugs for all the patients for the day. Which of the following drugs should not be drawn up into a disposable plastic syringe, labeled and stored in a lockbox? That's going to be propofol and diazepam, because diazepam is a controlled substance, and propofol, it has like an egg binding substance, so it will melt the plastic. Propofol is a liquid emulsion that serves as an excellent growth medium for bacteria. Okay. And diazepam will bind to the plastic. Okay. But I was right. That it was those. What is considered a normal pulse oximetry reading? 98%. Coxiella burnetii is the cause of which zoonotic disease? Q fever. I'm going to write that one down. Oh, we got our first flashcard of the study session. Coxiella. So I'm just going to write Q fever. And that is Coxiella burnetii. It's gram-negative. Inhalation. So cattle, sheep, goats. And it's from inhalation of birth tissues. I'm just going to write inhalation / urine. And then cat scratch. Those are the ones I confuse, is Q fever and cat scratch. So, cat scratch disease. By the way, you never want to get bit by a cat or scratched, but getting bit is even worse because you will get a infection. And whatever area you're bitten at will swell up like crazy. Oops, I wrote the wrong one. It is Bartonella. That's all it really says. And plague is Yersinia pestis, gram-negative. Cerumen is earwax. Wait. Yes. That cat looks just like one that we saw today. That was a chill appointment. That's crazy. Also, yes, I have a pimple and it looks really bad and I'm sorry. I look not the best right now. Luckily, no one's gonna see this. Cat presents with history of having difficulty walking and is dragging one of its back legs. The limb is cool to the touch. The veterinarian diagnoses a saddle thrombus. Which of the following underlying diseases is most likely present in the cat? Saddle thrombus. Oh boy, I remember this. I think it's renal. Oh. Heart. I knew that. Aortic thromboembolism or saddle thrombus. Is complication associated with heart disease in the cat. Thrombus is a blood clot. An embolism of clot lodges inside the blood vessel. Develops due to underlying cardiomyopathy. Clot forms in the heart, then breaks through and travels blood vessels until it becomes lodged. Okay. Minute volume. Is it minute or minute volume? I should probably plug this in. I got this pimple in my hair, dude. Minute volume is respiratory rate multiplied by tidal volume. We got a drug calc. 50 kg, 0.1 mg per kg, 0.01 out of 1 mg per mil, 0.5 mils. Easy. Nervous tissue without myelin. Gray. Without, you're gray. The world is gray without myelin. And white is myelinated. Ferret presents in lateral recumbency, hypoglycemic. What veterinary injection? I give you sub-Q fluids. What fluids cannot be given sub-Q? Dextrose sodium chloride, because it is a colloid. No, because it is a hypertonic solution and can cause sloughing of the skin. Okay. The white part of the eye is the sclera. Hemocytometer is for a erythrocyte count. Manual blood cell count. What causes metabolic bone disease in tortoises? Improper calcium phosphorus. How is tularemia transmitted? Tula tick. Ticks. I always think of it like Tula is a tick. It's a girl that's a tick named Tula. How long after birth can foals absorb protective maternal antibodies? 18 to 24 hours. When are needle teeth in piglets usually clipped? 3 weeks. Within 24 hours. What should be done when administering oh my gosh. Someone from college This random girl who was my classmate, one of my classmates in one of my classes in college, just tried to FaceTime me. I haven't talked to that girl in like 5, 6 years. She obviously did not mean to because she started it and then she ended it immediately. That's just wild. Ironic that I'm studying for the VTNE too. I wonder whatever happened to her because I don't think she finished school. I don't know if she stayed in the vet med field or not. Anyways, Miranda Class. Not her name's not Class. That's her last. I put her last name as Class because her name's Miranda and she's from Class. She's watching this. Hi. I saw your FaceTime call. I fear this is too quiet. Oh well. What should be done when administering nitroglycerin paste to a patient? I don't know. Wear gloves? Okay, I guess you wear gloves. Which blood cell plays an important role in clotting? Platelets. That was the dumbest question ever. Not dumb. I'm sure someone has struggled with that. But I haven't. 8 hours. Okay. What is the ideal diet to feed a healthy lactating dog? Puppy formula. You have a small canine patient in cardiac arrest that needs emergency drugs. The animal does not have venous access. It would be too difficult. What's the best way to get the drugs in this animal quickly? Intraosseous, that is into the bone marrow. You're developing a template for the drug labels at your new hospital. Every prescription drug label should include a statement for veterinary use only. Oh. Caution, federal law restricts this drug to be used to use by the order of a licensed veterinarian. Testing for failure of passive transfer should be performed between 8 and 24 hours of a foal's birth. What are you testing for? Immunoglobulins. An obese cat presents for not eating and vomiting clear fluid for 1 week. When you weigh the patient, he lost 2 pounds, and his skin looks yellow. What explains yellow skin? Hepatic lipidosis, which is fatty liver disease. Usual vector of Western equine encephalitis, mosquito. When placing lateral radiographs of the stifle joint on a view for a veterinarian to evaluate. How should the film be oriented? I never get this question right. Should be on the right and proximal. Nope. The left and proximal aspect should be toward the top of the view box. I don't even know what that means. If I get that question on the VTNE, then I guess I'm screwed. 4-year-old puppy is presented for rapid breathing. The breeder also mentions that the puppy has been spitting up frequently. What might this puppy have? Rapid breathing and spitting up frequently. Megaesophagus? Yeah. Okay, what quantity of drug is found in 200 mils of a 10% solution? 200 times 0.10. 20 mils out of 100 mg per mil. So 0.2 grams, so 20. I got it wrong. Yep, 10% is 100 mg per mil. So if 1 mil is 100 milligrams, times 200 by 100, and that's 20,000. So 20,000 milligrams in 200 mils. So it'll be 20 grams. Nutrients must piglets be supplemented with? Iron. We knew that. When performing treatments on a horse, you need to apply DMSO topically over a region. Which of the following personal protective equipment should be worn? Gloves. Some of these are so easy, which is annoying because the questions on the actual exam are like 5 questions combined into one. And if you get 1 out of the 5 questions wrong, then you get the wrong answer. You know? You know what I mean? Ivermectin would not be used when treating which parasite? Ticks. No. Trematodes, because trematodes are flukes. Okay. When would a defibrillator most likely be used and effective? Ventricular fibrillation. Okay. Castration and emasculator. Okay, this is a reproductive question, which I think we should get into. Which hormone is the trigger for ovulation and development of the corpus luteum? Trigger for ovulation, progesterone? Or is it the luteinizing hormone? I think it's luteinizing. Yep. Flashcard. I feel like such a weirdo talking out loud about this stuff. Trigger. Luteinizing hormone triggers ovulation and develop of corpus luteum. Oh, I wish I went back to that because that had stuff about other information of the other questions, of the other answers. Words. I'm so tired. I had a lot of caffeine today, and I'm crashing now. I just realized I have not been playing music this entire time. I haven't been playing music. That's crazy. Is it 9:30? Damn. Okay, I'm playing music now. $30. You don't even need to know that question. I forgot you were still there. Okay. I feel like I'm going crazy right now. Can I get a kiss? Maybe make it last forever. You say I'm about to go to war. Crow. He's sleeping. Bro. Okay, look at this. Look at how many questions there are. 900 starred questions. Granted, like, it counts all the ones I got wrong for the same question until I get it right. And then it moves on. Okay, I got this around quite a lot. Oh wait, this is a different one. So it's not really 900 questions. Probably like 400, but still. I'm so tired.
Which of the following arrhythmias can be alleviated by exercise?
Second degree AV block. I gotta sneeze. Egg larva nymph adult for ticks. Okay. I can't do this. I can. Just laying in my bed, reviewing the flashcards. I'm gonna do that and then go to bed. And I don't want to record that, so. Oh, I need a shower. Okay. I'm gonna go. I can't believe this microphone survived the entirety of it. Thanks for watching. Bye.